Welcome to another episode of Breaking into Cybersecurity, where today our featured guest is Adin Stein, who has a varied background in different areas of critical infrastructure. And listening to his overview of his background in prep today, I was amazed, but I'll let him dive into that. Aiden, why don't you tell our guests a little bit about yourself and then we'll dive into your background?
Awesome. Thanks, Christoph. Thanks for having me. So yeah, I think I took a circuitous path towards cybersecurity. I really started in smart grid, smart energy. So that's energy tech. And I had the privilege to work under the founders of what we call today our smart grid, which enables things like EV and renewable energy. And we were really focused on data acquisition and built the largest at the time, largest fixed cellular network in the world with the most number of endpoints under it. I think we had something like 40 million endpoints. This sort of predates the adoption of cell phones, consumer-based cell phones. And so each one of those endpoints was a smart meter that we ultimately installed at residents and commercial buildings to acquire data and sort of power things like time of use pricing, which we're all used to today, and other sort of services for the energy space. And my role there started, what was the beginning of my career. So I started as a system administrator, and that gave me sort of the technical chops to understand operating systems. And it was an all Unix based system. I ended up in operations, and that helped me build the foundation for firefighting and crisis management, because as an operator of these systems processing hundreds of millions of meter reads every single day, things go wrong. And you got to keep cool under pressure, and you got to attack things methodically. And so that gave me some foundations, which was later used in cybersecurity and incident response. And then I also got into database analytics. So really understanding the data that we were collecting and understanding the power of that data. And so that sort of led me to work in database administration, and was able to cut my teeth on how do we secure large Oracle databases with large, really important infrastructure and information. And yeah, I think that sort of rounds out my roles at CellNet. But once we acquired the data, the next step in that process is, what do you do with it? And we ended up creating a company around the analytics of this data. eMeter was the name of that company. And I had a variety of roles at that company, which really did solidify the foundation for a career in cybersecurity. So at eMeter, I started running IT, and that got me involved in building out networks from scratch, securing networks, vulnerability management, patch management are obviously piece of that. Network security is obviously a piece of that. Building out large database systems, and then, of course, system administration. And at the time, we built that in our own data center. Disaster recovery is obviously a key piece of that, whether it's DR planning or DR testing. And that really gave me a lot of fundamentals to build from, and really was the spark and my first real interest and love for cybersecurity. I then later moved into support and technical services. And so in support, that gave me a direct customer facing role, which I ended up double down on. And in that role, this was early cloud adoption. In fact, no one in the energy space at that point had adopted cloud, but we were building services, and I was used to supporting sort of these on-premise installations on these large high cluster compute environments, and said, hey, I think the cloud can bring something to the table. And so we actually launched a SaaS offering, and I was able to convince the folks around me and some of the stakeholders that cloud was the way to go. So brought cloud into an industry that ultimately had not adopted cloud at that point. And that gave me foundation as well to think about, how do we secure the cloud and what's different about cloud compute than, say, virtual compute that we were all used to at the time. From there, I ended up moving to Europe, and I was first boots on the ground in EMEA. And my role was to run all of the delivery and professional services functions for EMEA, and then, of course, support sales in doing so. And so I was able to grow that business from one customer and no partners to a whole ecosystem of partners by the likes of IBM, Accenture, and really built that from a few $1 million a year to a really viable business around $40 million a year annually. And that really was an exercise in trust building. And I think that's a really important function of any cybersecurity professional, is the ability to build trust, not only in your internal stakeholders, but in this case, in our customers. And so that was a skill that I picked up along the way. And of course, developing partnerships. I then made a large pivot. So eMeter was sold to Siemens. I moved back to the United States and I decided that I wanted to be more mission focused on healthcare and life sciences. I decided that I wanted, and I really liked the immediacy of some of that. You're working in a world where we were large enterprise systems being sold to utility companies throughout the world. And the idea of selling either B2C or B2B, but in smaller implementations excited me in terms of the immediacy of that. And then of course the impact in terms of healthcare and life sciences. So that was a big industry pivot for me. And I was an early founder of a company called Station X, who built large genomic analytics software that we were selling into pharma and biotech. And my role there was first from a strategy perspective, how are we going to, what was our deployment model? We started as an appliance that we would put into a customer's data center. And I quickly made that same pivot that I did in the energy space to say, you know what, I think SaaS is a better way to go. I think building this on cloud is a better way to go. I think we reduce our innovation cycles. And that was my first job. My second role was really to build the infrastructure, the cloud infrastructure. Okay, and yes, we think that's a great strategy, but how do we do it? And what are the nuts and bolts? And what does DevOps look like? And what does CI/CD pipelines look like? And so on. And I built all of the infrastructure to house thousands of genomic sequences and on the cloud, partnering with AWS, which was really rewarding. And that was my real sort of compliance and security sort of official role, because that was a gap and that was something that our customers demanded. And I built out our entire HIPAA program from the ground up. Of course, at startups, you wear many hats. So IT was, of course, still mine, and ran IT all the while doing this. And yeah, we built a security story. It was modest at the time, given the resources that we had. And we built a full HIPAA compliance story around the business. And those were key enablers for the business. Those were things that our customers demanded, and we filled the gap. I would say, yeah, a lot of key lessons learned there, but one was just taking those skills from larger enterprise systems and moving them into a SaaS sort of offering was really an interesting key takeaway there. Station X was sold to Roche. And so I worked at Roche for a short period of time, head of their sort of cybersecurity for decision support systems. So these were systems that were used to support physicians' decision making, particularly in oncology. And there, again, leveraging sort of my background, I was responsible for cybersecurity and DevOps. And this was selling into large healthcare systems in the United States, in Europe, and ultimately in Asia. And there was a lot of distrust at the time around our use of AWS, housing data in the United States, what was going to prevent the government from walking in, taking hard drives and taking our patients' data. And that was really top of mind. And then it just happened to be right around the time that GDPR went live. And so I took on the responsibility of making sure that the systems that we were building were GDPR compliant. It was a customer facing role as much as it was a technical role. And at Roche, we built high trust program and were able to achieve high trust certification, ISO certification, and SOC 2 cert. So that was really where I cut my teeth on some of the larger frameworks and certification programs, and also had some of the most skeptical customers out there and had the privilege and responsibility of putting their minds at ease, allowing them to sleep at night and assuring them that we had the right processes in place to alleviate any of their concerns.
So many questions into that journey. It sounds like potentially a lot of things might have happened at the right time at the right place, but that might be easy saying in hindsight. Was there any planning that you did prior to any of these pivots into when was it the right time to make these realignments, or how would you skill up to get the needed skills and competencies to go into the cloud space, to go into the compliance spaces that you weren't in before?
Yeah, some of it was opportunistic, as you said, and it was the right time and right place. These are skills that weren't readily available. Cloud technology was relatively new. When I started working with AWS, they had 2 services. I think they have over 200 today. Finding that skill set on the market was impossible. And so we had to home grow it, and we did. And I led teams. And part of that process was myself taking the training and offering that training to my team so that we could build in-house skills. I don't think that do think that most of my career up until this point was relatively opportunistic, although there was a key decision to move from energy to life sciences. I think it was after Roche where I joined Lyle Immuno Pharma, where it was a much more methodical, thought through decision making process. And part of the opportunity there was getting closer to the patient was really important to me. I wanted to move into how do we impact patients. I'm very mission driven. And I think that's a key theme throughout my career. And when we moved to Lyle Pharma, this was an opportunity to build cell-based cancer therapies for patients who were suffering. And at Lyle, this was a company that raised a very large amount of money in their Series A and went IPO very quickly and had ambitions to be in the clinic very quickly, and quite a complex environment. And so that was really part of the equation was how can I leverage some of the experience that I have? It's pretty broad and pretty deep. And so how can I make sure that I'm leveraging as much of that as possible in my next role? And that was Lyle. And so at Lyle, I was managing IT, but a much more complex IT environment, including all digital cell-based manufacturing plant and facility, all of our R&D, so all of our labs that were either in South San Francisco or Seattle, so multiple locations, and then our clinical operation. And all of this comes with an increasing level of compliance. So now we're talking about GXP compliance and 21 CFR Part 11 compliance, so FDA compliance. And so the bar gets raised even higher. And so that was the story at Lyle. And what was appealing for me at Lyle was how can I up level my career and that was let's go after bigger, harder challenges at that. And then again, same sort of decision-making process. When I left Lyle, we went from 0 to IPO in 2 years. Not only did we have to be GXP compliant, but we also needed to be SEC compliant. And that really gave me the sort of ability to put in large ERP systems, to think about Sarbanes-Oxley and how do we become SOX compliant and running those programs and do so in a really accelerated pace. And so we took Lyle public and I did leave about, I don't know, a year or so later. And my drive to leave was really prompted by my desire to, again, get closer to the patient. So that's when I joined Rune Labs. Rune Labs is building software that was built on the Apple ecosystem and was direct to Parkinson's patients. And ultimately can claim that building the software and services and biometric abilities using the Apple ecosystem able to reduce ER visits for Parkinson's patients by 48%. So really tremendous work there. But from a cybersecurity perspective, now we're talking about B2C and we're talking about now public threats, right? Or more public threats. And the exposure might be a little bit higher in this case. And again, repeating and leveraging the work that I did at Roche to become high trust compliant was really important for Roche, of course, HIPAA compliant, GDPR compliant. And so we were able to build those from the ground up. This is a small startup making large impacts on patients. And that's where we are up until today.
I think it's one thing to say you're pushing the lines with regulatory leaders when it's a new space and you're having to help them invent how they measure the bar. But then when you're doing that in a consumer space and there's no research as to the trials, the impacts, and that as yet, and you're trying to get into the consumer market and the threat space is considerably larger than, say, the research lab or the university research labs compared to a pharmaceutical grade research lab. It makes looking at your threat attacks, your threat life cycle management that much greater, and even looking at your supply chain attacks even that much greater. How do you even bifurcate all the aspects of your security program to be able to manage all the components in any meaningful way and still be able to focus and think on something strategic like go to market approach or something like that as an executive?
Yeah, that's a really great question. And at Rune, this is poignant because at Rune Labs, not only is that a B2C or B2B play, right? We're really offering services directly to patients, but it's also a B2C play. Part of what Rune does is support clinical trials for biotech. And so there is not only that consumer piece of it where we need to attack that surface, but there's also the compliance piece of the equation where we need to be GCP compliant and FDA compliant because the data that's being leveraged and used for these clinical trials are affecting decisions around patient efficacy and safety, which is really important to the FDA. So we built six cybers, and all of that is predicated on data integrity and cybersecurity, right? That's really what the FDA is interested in. Can I trust the data? And if I don't have a good cybersecurity posture, then we're not going to be able to trust the data. And so we integrated this directly into our software development lifecycle, and we automated as much of it as possible because we couldn't manage a quarterly release. Life moves too fast in a startup. And while that might be status quo in the industry, it wasn't going to be acceptable for us. And so we needed to automate as much of this compliance as possible and move that from quarterly to monthly or weekly. And that's just to accelerate those innovation cycles, ultimately get features and product out to the market faster. I think that the cloud and having a declarative environment improves your compliance and your security posture. And so we really leveraged decades old now at this point, standard software development practices and integrated the cybersecurity controls into that. So you talk about supply chain management and understanding what is your bill of materials when it comes to your software. And we are able to have tooling in place in CI/CD processes that automatically kick off upon merge or even pre-merge that assess and build that bill of materials. And that ends up in our validation documentation.
Interesting. And even as you think about the electronics that go into devices and their life cycle and keeping them secure for their life cycles for the consumers, but keeping them functional and secure for their life cycle, not just functional, but functionally secure. Many years, I think 3G really just got phased out 2 years ago, and a lot of consumers had relied really heavily on 3G detectors for if they fell or for their medical grade medical devices to report back to their doctors on their health conditions. But how do you do so now in a cloud environment and keep it secure and keep it functional without having to upgrade it every 2 years as you would your Bluetooth headphone or something like that? But that's a very interesting challenge, and hats off to you because I would say that the challenge there is really interesting. For those that are interested in this space, both from an innovation standpoint and a security standpoint, what recommendations would you have for those looking to get into this space?
Yeah. I think the first thing I would advise any sort of young person interested in cybersecurity is pick your domain and pick a domain that really excites you. And I would say that for any professional, but specifically for security, and then go deep into that domain. So if it's healthcare, go deep into healthcare. If it's energy, go deep into energy. I think that will serve you well. It will make the hard days, easier. So I think that's the first. I think the second is really understand what security and compliance frameworks are important to that domain. So high trust is really important in the United States for healthcare. Not as important in Europe. In Europe, they, I think, value ISO over high trust. And so you have to think about what geographies you're going to play in. But once you get that landscape, really understand what those frameworks are because those will be transferable from company to company. So I think that's really important. And then I think the last piece here, or maybe the third piece, is be really curious. Cybersecurity is changing radically with new technology and new advancements. At one point it was cloud and then it was next gen AV, and you can fill in the blanks with all the technology that's made itself available. And now you're in a world where first of all, we have a deficit in terms of number of cybersecurity professionals needed across all industry, across the globe, the United States. And the technology playing field that we're playing with, that ecosystem is evolving rapidly with with AI. And so it's a very crowded space. I would say there's a lot of garbage out there, but I think there's a lot of gems out there that can really transform your cybersecurity program. And I think executives are struggling today navigating that landscape. And that curiosity is going to pay yourself dividends because you can really place yourself as an expert and really understand what tooling is out there, what value does each tooling bring. I'm really excited, for example, about this technology being able to provide really large enterprise security dimensions. So, for example, red team, blue team functions that you wouldn't normally build in, say, a small startup like Rune. But now, as you get into this AI driven synthetic sort of red team, blue team world, you can start to take some of those really larger security postures and bring them into small and medium sized businesses. So it really is changing the landscape and it really is allowing us to improve our overall security posture, but it is very difficult for strategic thought leaders to navigate. And so I think that's where folks are struggling today.
And do you see AI as an enabler or as a replacement for, say, low-level junior talent?
I'd say it's an enabler. You still need to interpret what these the AI is telling you, what these tools are telling you. So for example, we did a pretty quick experiment using Anthropic's Claude. We took our entire sort of universe of policies and said, hey, assume that we are doing everything that these policies say we're doing, assume that we can demonstrate that with evidence, look at these policies, and then go look at the HIPAA framework and tell us where we have gaps. And within 5 minutes, we had a working list. And we could, but now we need to interpret the list. And so there's still that AI is not quite there. We still need to do the interpretation. And I think that's true for other AI tools that might say, hey, you have a vulnerability or a threat. It's still not at the point where it can really understand what your tolerance for risk is, for example. So if you're doing threat modeling, you may come up with a threat, but you might say, hey, we're willing to accept the risk on that because the likelihood is extremely low or whatnot. And I think that still requires human in the loop. And then I think as you move towards cybersecurity leadership, it becomes your responsibility to translate that deep technical knowledge into business and business impact so that you can have a reasonable conversation with stakeholders within the company. What is the risk? Can we tolerate it? Can we accept it? Do we need to mitigate it? Are there compensating controls that we need to put in place? And I don't think that AI is there to replace that decision making. I think it's there to really facilitate it.
I love this point of view. Going down this rabbit hole, then everyone wants to use AI, but do you think most organizations even have the foundational framework in place to really understand the risk of using AI models internally or externally and the amount of data they expose to it?
Yeah, this is a really great question. I think it's hard for me to assess, but my gut says no. I don't believe that there is a well adopted sort of governance framework around the adoption of the technology. At Rune, we did put in a governance framework. We were able to score AI on, I think, something like a dozen different dimensions from transparency to reliability and accuracy. And so we were able to come up with a scoring system that allowed us to elucidate threats from the developers. What was happening was developers were saying, yep, here's a great use case for AI, but we're really nervous in a healthcare environment because of all of the following reasons, whether it's exposing data or maybe giving misinformation to a patient or going outside guardrails and practicing medicine and telling them to change their medication, things that could be really impactful from a legal perspective or from an ethical perspective. And unfortunately, what I was witnessing was that the engineering team was coming up with really thoughtful, and this was the really great part about this, reservations for using the technology. So that was something that was embedded into our culture and I really love, but they were ruminating on it in a way that was affecting the ability to make decisions quickly and effectively. So we put a framework in place. We lifted that up and took that away from the individual developer's responsibility. but still gave them a path to raise these issues, and then built this scoring system and then a governance body that could evaluate these things and make decisions. Some of the decisions were, yep, we get it. That is a risk. Let's put a human in the loop and let's continue that human in the loop until we get to a comfort level, right? Statistically. And so let's generate the data. Let's run this in a small segment of our patients with their consent. And then as we got more experience and could fine tune things to the point where the human no longer needed to be in the loop, we removed the human. So that was one outcome for our use of AI. But I do think that having these governance bodies in place and these frameworks in place are going to be really important, not just from a cybersecurity perspective, but across the board.
Couldn't agree with you more. And last thing I'll just mention a recent study done by Anthropic in this area. Don't let the AI systems know that you want to shut them down. Otherwise, they might go about blackmailing you. Aiden, thank you so much for coming on the podcast, sharing your career journey and your perspectives. Appreciate you so much.
Yeah, likewise. It's been a pleasure. Thanks, Christoph.
Thank you.
Take care.